My name is Anna K. Rule, and welcome back to my channel. I hope you're doing well. I hope you're having a good day, and I hope your week is going well. So I want to talk a little bit about some of the signs and symptoms that I've either observed or read about or had my colleagues inform me about as regards to how our children may exhibit exposure to COVID-19. Now, I know with a new variant, the symptoms may vary, and just let you know, these symptoms aren't definitive. It's not like facts that is for every single case. They may vary from case to case, but I just want to share with you my experience thus far. So I know one of the things that we tend to look for are what we call the primary symptoms: the constant cough, the fever, or the shortness of breath. Now, as regards to the constant cough, it is an iffy one because I remember I've had, when I make an assessment, I'm like, is this a constant cough or is it just a frequent, intermittent cough? But when you hear the constant cough, you would know. It's kind of be a cough where every minute or so the child is coughing without any exposure to an irritant, meaning they're not outside by the dust, or there's not no cold air, or their throat is not dry, or any reason that would cause them to just trigger this cough. Additionally, when it comes to the fever, we have a child of elevated temperature, maybe like 98.9, 99.8, or a temperature that's not their normal. However, normally it's like when it's 100.4, that's when we would see the child definitely a fever. So I would say still pay attention to elevated temperature, but the fever is normally one would be the primary symptom. And the shortness of breath is also the primary symptom, or difficulty breathing. And this is not shortness of breath where a child has a history of asthma. Children with a history of asthma, it may trigger them to have a shortness of breath, but it's a child with no known respiratory illness and is having this shortness of breath or difficulty breathing. Additionally, I want to talk about our secondary symptoms, because I've had cases where I talk to parents and they're like, my child does have a fever, they don't have a constant cough, and they're breathing fine, so why do you think, or why would you expect me to have my child tested for COVID-19? Some of the secondary symptoms that I've observed in our younger children are actually things such as headache, a runny nose. Now, as regards to the headache, in children, the symptoms don't come as one big cluster. So while an adult may have a headache, a sore throat, a runny nose, a fever all in one, our children may not. And then, for example, when it comes to headache, a child may have a headache today, and they didn't say anything to you. Tomorrow, the headache may be gone, or it may not be as, severe as it was the day before. I've had kids who have tested positive before, and all they had was a headache. And the parent tested the child because the child wasn't exposed, because the parent himself was tested positive. And they figured, let me try to test my child to see how my child is. And all the child had was a headache. Additionally, too, when it comes to a runny nose. Now, runny nose alone normally would not be a definitive sign, but it's something to be mindful of, because they're still in the flu season, that's one. Additionally, there are allergies out there, so the child may have a runny nose from that. But a runny nose with anything else, and when I say anything else, I mean like a headache or any other symptom, is something worthy of paying attention to. Another symptom I observed in my younger kids are GI or gastrointestinal symptoms. These include a stomach ache, nausea, vomiting, and diarrhea. Now, the stomach ache is not the stomach ache that they had some milk, or they had some macaroni up in the salad or something that caused them to have a stomach ache. This stomach ache that has no known or definitive cause. So they probably ate like hours ago, or maybe the stomach ache started before they actually had a meal. And then with that stomach ache, they can feel nauseous, and they just start to vomit. So I've seen diarrhea as one of the kids, but I've seen more nausea, vomiting, and stomach ache than I have seen diarrhea. But the children may have GI symptoms. So when those GI symptoms present themselves with anything else, so like I said, a GI symptom with a headache or a runny nose, 2 or more of those symptoms are worthy for you to pay more attention to and to consider having your child getting tested. Another secondary symptom is sore throat. So sore throat can be hard to define, especially in our younger kids, like maybe those under 3 or so, to say, do you have a sore throat? And they'd be like, oh, what does that mean really? So what I would say to my younger kids, I'd be like, does it hurt when you try to, swallow? Or I say, does it hurt here? Does it hurt here? Or they give them a sip of water and say, does it hurt to drink the water? And they'd be like, a little bit, not really. But once the answer to that sore throat question is not a no, so once there's a little bit or maybe, then I would say consider it as a actual symptom. The older kids can say, I have a sore throat. They're older and they can say things like that. Another thing in our children, and it's one that is not so common, but I have noticed it, is eye irritation. So eye irritation could resemble that of a pink eye or conjunctivitis. So the eyes are irritated, you may have like mucus buildup or discharge, or it may just be red and you're like, that's a little bit strange. And the child may even be taken to the doctor and be treated for pink eye. But if the pink eye presents with something else, so remember, normally if you have 2 or more secondary symptoms, I would say pay more attention. So if it's a pink eye with a headache or a runny nose or a stomach ache or a sore throat, then I would say pay more attention to those symptoms. Additionally, too, when it comes to our children, is that they may feel so tired. So, with school starting back and school already in session for some, getting home from school the first 2 days or so is going to be exhausting naturally. So you'll be like, oh, they just had a long day at school. But when I say tired, it's that the child is not able to do their normal activities. So your children. Your child will normally get home and just run to, eating or go playing with their sibling or watching TV. And the child is not doing their regular routine. Additionally, too, when it comes to our children, we need to be mindful that children are so resilient. Take, for example, when a little child wants to go to the bathroom. They wait until when they want to go to the bathroom now. They don't wait until when the first urge comes and they say, maybe I should go to the bathroom. No. They continue playing. They continue what they think is important. And then when the moment they want to go, that's when they rush coming down. And that's when it becomes urgent. So sometimes they do that when it comes to illnesses, especially if it's a case where the child, is so preoccupied. So maybe it's a case where they had a headache in school. And then they got home and they were so distracted the headache was not as crazy because they took a nap maybe or they ate, so it got less severe. And then tomorrow they may have a stomach ache. So with our children, it's like when you're asking them how they're feeling, it's not going to ask them how they're feeling right now. Ask them how they felt yesterday or the day before yesterday, because the symptoms may not present as clusters, but rather than one behind the other. And then eventually by day 3 or 4 after being exposed, they have a whole bunch of symptoms. So one of the things I said, sometimes you don't know the right questions to ask, but it's to pay attention to our children. Don't be so quick to dismiss, their complaints. Because one of the things is that I know that sometimes I talk to parents and they're like, oh no, they only say they have a stomach ache because they don't want to be in school or because they don't want to go to school. And also, if you find your child complaining about being ill and not tell the truth about being ill, not to be in school, that's something for you to explore on a different basis with either the teacher or the guidance counselor, because that would be something worth exploring. But don't dismiss your child's complaint because they are used to making up these stories. I mean, our children have a very wild imagination, but just don't dismiss it. Pay attention to it. And also, as I said, note the symptoms over the last couple of days. And then, as I said, the fever may not appear initially. I've had cases where the fever appears after day 4 or so after being tested positive. And that's when the fever starts to develop, or day 2 or 3. So it may not be the first symptom that you notice. Another thing, as I said too, is if you don't know the right questions to ask, you should just document or write down what your child has complained about. And if you have access to a helpline or a number that provided by a county or your government to call that number and ask these questions. And if it's a case where you have access to getting the child tested, just a test to be sure. And what I would encourage my parents and my caregivers is, if your child shows any symptoms and you think it's necessary to have that child tested, please keep that child home or away from other children. Because if you thought a child needs to be tested, that means that there's something in the back of your mind that's saying, my child may not be well, my child is ill. So until you get that result back, I would say discuss it with the school or wherever, the child is going, that, hey, it was recommended my child get tested. I just want to be cautious. And healthcare providers and teachers will appreciate you taking that extra step by isolating your child until you know exactly what is going on. So once again, I said, these are things that I've observed, right, or my colleagues. With the Delta variant and different strands of COVID, the symptoms may be different for each child. So do pay attention to all the symptoms. They're not definitive symptoms, but it's just I want to share with you what I have been observing or noting so far. What I would say is just do the best you can. Try to stay safe. Do what you can, and what you and your child or children can do to stay safe, and just hope for the best. So be well, stay safe, and until next time, take care.